Hi.
Kaylin?
Yes.
Hi, Kaylin. My name's Calvin. I'm your physician assistant today.
Nice to meet you.
Nice to meet you too. So, tell me what's going on. What brings you in here today?
So I've just been having stomach aches for the last 3 days. So I just wanted to come check it out because it seemed like it was a little longer than I expected.
Okay. Said for 3 days. Okay. I'm sorry that you're feeling lousy. If you had any kind of diarrhea, vomiting?
I had a few episodes of diarrhea as well
Okay.
throughout the 3 days.
Like once a day, twice a day?
Twice a day.
Twice a day. Okay. And have you eaten anything differently recently?
No, not really.
Okay.
I ate out at a restaurant.
Oh,
And
okay.
when it started, I was eating out. But other than that, I don't think anything out of the ordinary. No new foods or anything like
Okay.
that.
Alright, well, I'm sorry that you're feeling lousy. Just some demographic information. What's your date of birth?
November 9th, 98.
Okay. And, let's see, today is the 23rd at 5:45. These just things that we ask everyone. It's documentation stuff. And, you identify as a female.
Yes.
Okay. And, what's your ethnicity?
Asian.
Asian, okay. And, do you work?
So actually, I'm a student.
You're a student? That's a lot of work. I remember
Yeah,
being
exactly.
a student. Yeah. Would you say you're in pretty good general health other than this?
Yes.
Okay, well that's a good thing, definitely. And are you married? Single? Well, not hitting on you.
Single. Single.
Okay. And let's see.
In school, can't deal with it.
Yeah, there's
Too hard.
too much time. I get it. I totally get it. Yeah. Okay. And so you said it all started in you said about 3 days ago?
Yes.
Okay. So you said it's your stomach. That can mean a lot of different things. Can you tell me a little bit more about, like where, could you maybe point to where it hurts?
Sure. I would say it's more up here.
Okay.
Yeah.
Like kind of below your rib cage?
Yeah.
Okay.
Or like higher up, I guess. It's not really like low.
Okay. And does anything make it worse? Or
Not really. Just
okay.
I guess laying down makes it better, but
Laying down makes it so okay. Anything else that helps?
not really. I
Okay.
tried like Tums. Haven't really worked.
So Tums doesn't do anything. Okay. And are you having any vomiting? I don't remember if I asked you that.
No, I haven't vomited yet.
Okay, but you said you've had diarrhea for a couple
Yeah.
of days. Okay, or a couple times a day. And where did you go out to eat? You said you went to a restaurant, right?
Yeah, it was just an Italian restaurant. I
Italian.
don't remember the name.
Okay, gotcha. But I bet you remember, what you ate for a long time.
I mean, it was good.
Yeah. But I guarantee you're not gonna want to eat that for a long time. Let's see. Have you noticed that this has stayed about the same, or has it gotten worse?
I would say it's like gotten a little bit better actually
Okay.
over time. Yeah, but not by much, as much as I would want to. Still like.
Okay. Is it kind of stay in the same spot? Does it move around?
Yeah, it just seems to be in the same area the whole time.
Okay.
Maybe a little bit more. It spreads a little bit, but maybe towards the middle a little.
A little bit towards the middle.
Yeah.
Okay. So where does it start and then where does it? You said
So it's
ends?
more on the right
More on the right
side,
side, okay.
and then it moves towards the middle, up higher.
Okay. So like starts about right here and
Yeah.
then moves up to the middle. Okay.
Mhm.
And would you say it's constant? Like does it kind of come and go during the day?
Yeah, it's not 100% constant throughout the whole day, but it's there pretty often, most of the day.
Okay. All right. Let's see.
Like it improves sometimes, and then other times it's not as painful. You know what I mean?
Do you notice, like, is it maybe like the time of the day?
Not really. It's just throughout the day. It's kind of like feeling better, feeling worse.
Would you say maybe it's worse after you eat something or drink something?
No, nothing related to eating.
So it just kind of does whatever it wants.
Yeah.
Gotcha. That's unfortunate. What kind of pain is this? Would you say it's like, this is like achy?
It's like a crampy in a way,
Crampy,
I would
okay.
say.
And have you ever had anything like this before?
I've had stomach aches before, but I guess they were a little different. They didn't last as long.
Okay. So, it's lasting longer this time, okay. And you said it travels from the right side to the center.
Mm-hmm.
And how bad is the pain? Like, how hard is it to do things?
It's fine. Like I just like push through. It's not like immobilizing me from like getting up, but
Okay.
it's still just uncomfortable.
Okay. If you were gonna rate it on a scale of 1 to 10, 10 being the worst that you've ever felt, where would that fall?
I would probably say a 7.
7?
Most of the time, on average.
Wow. That sounds pretty awful.
Yeah.
Jeez. Must have a pretty high pain tolerance.
I don't know about that.
Okay. Let's see. I'm gonna ask you just a few general questions. A few questions about, this is just to get a better idea of what's going on. We just ask this for everyone.
Sure.
Let's see. Okay. Have you what is your usual weight?
About 115.
Okay. Have you had any recent changes in your weight?
No.
No. Okay. Have you noticed any clothes maybe a little bit baggier or tighter than normal?
Nope.
Okay, that's a good thing. We want to try and we want these to be no answers. So
Yeah, exactly.
so this is a good thing. We also want you to be honest. Any weakness lately?
Nope.
Any fatigue?
I guess I've been a little more tired than usual just because I don't feel like getting up as much with the pain, but otherwise, no.
Okay.
That might just be me.
Well, this day is about, or this time is about you, so that's totally okay. Any fever?
Nope.
No fever? Okay, that's good. No fever. Alrighty, and let me just do this. Have you had any headaches recently?
No.
Or, going on with this?
Nope.
Any dizziness or lightheaded? Okay. And let's see. Okay. Have you had any trouble swallowing since it started?
No.
Okay. Any heartburn? I know you said you took Tums earlier.
No.
Okay, that's good. How would you say your appetite's been?
It's been fine. I think even though, despite the pain, I think I've still been eating enough.
That's good. Okay, cool. Any nausea with this?
Maybe a little bit.
Okay.
I haven't had to throw up, but maybe a little bit of nausea.
So you've been nauseated, but you haven't had to throw up yet.
Exactly.
Okay, gotcha. And irregular bowel movements. Obviously, you said you've had diarrhea.
Mm-hmm.
Okay. And I know this isn't something that a lot of people kind of think about, but it's a question that we're supposed to ask. Has there been any changes in the size or color of your stool lately?
No, I don't think so. I mean, it's kind of hard to tell sometimes.
Yeah, yeah.
Since it's like more of a liquid form, but.
Yeah.
No.
And next question's bowel habits. Obviously, this is something that
This is new.
Yeah, this is not normal for you. Okay. Is there any pain that's associated when you go to the bathroom?
No.
Okay. Any rectal bleeding? Any blood in your stool?
No.
How about any kind of like black, foul smelling stool?
No.
Okay, that's good.
Yeah. Just your little diet.
Yeah, right. Have you had hemorrhoids?
No.
Okay. And
Sounds painful though.
yeah, I'm sure. And you said yes to abdominal pain and diarrhea. Do you have any food intolerances?
No.
Okay. Um,
Sometimes milk and like cheese. And
okay, so some dairy.
some dairy, but just more of like a sensitivity. I don't think it'd be an allergy.
Okay. Does it kind of give you diarrhea when you eat a lot of
No,
milk?
I wouldn't even say that. I think it's just makes me a little more bloated
Okay,
and
bloated. Gotcha.
gassy.
Was there dairy in the food that you ate the other day?
No.
Okay.
Yeah, I thought about that.
Any excessive belching?
Nope.
Or gas? Flatulence? Have you had any changes in the color of your skin? Any jaundice?
No.
Okay. You ever had any trouble with your liver?
Nope.
Your gallbladder?
No.
Okay.
I'm glad.
Yeah, that's something that sounds very painful. Have you had hepatitis?
No.
Okay. Alrighty. So would you say the nausea and the fatigue, did that all start around the same time, or? Okay.
About the same time. Maybe the nose started like a little bit after. I would say the abdominal pain was the worst in the beginning.
Abdominal pain is the worst in the beginning. Yeah. Okay. But the nausea was a little bit after that?
Yeah,
Okay.
slightly after, I think.
Okay. And is the nausea pretty disruptive to your day-to-day tasks?
No, it's really not that often, just on occasion.
Okay. Let's see. And is this something, the nausea, have you experienced something like that in the past?
No, not really.
Okay.
But it's there, but it hasn't been severe, I guess.
Okay, gotcha. And does anything kind of make that worse, the nausea?
Nope.
Anything make it better?
Nope.
So you're kind of flatlining there,
Yeah.
okay? Let's see. We're gonna go through some We're gonna go through some general questions. These are just questions that we ask everyone, so don't think that I'm singling you out.
No worries.
Okay. Have you ever had any medications? Sorry. Do you take any medications?
I take a multivitamin.
Multivitamin, okay.
Yep.
And do you know what the name of it is?
I'm not sure.
Okay. Is that something that you take by mouth?
Yep.
Would you say every day?
Yeah, once a day usually. I try.
Okay. Do you take any contraceptives or contraceptives?
No.
Okay. And do you take any other kind of supplements or anything?
Nope. It was just like I don't really take much, just the multivitamin and then the Tums that I take.
Keep it simple.
Yeah.
Okay, fair enough. Okay. Do you have any allergies?
Seasonal allergies.
Okay.
But other than
Do you know what you're allergic to?
that, everything outside basically.
So am I. It's lovely, isn't it?
Yeah. Trees, grass.
Okay. You get like the runny nose and all that good stuff?
Yep. Itchy
Okay.
eyes.
Yeah. And allergies to any animals?
A little bit to cats.
Cats, okay. Now, do you have any allergies to any kind of medications?
No.
Okay. Or to any food? I know you said a dairy intolerance, but
Yeah, no.
that's more, you said you get bloated and gassy,
Mhm.
right? Okay. No latex allergy?
No.
Iodine?
No.
Chlorhexidine? Okay. How was your health as a child?
I was relatively healthy. I'd say I have no real anything crazy.
Nothing crazy. Well, that's good. We don't
Yeah.
like crazy too much around here.
Yeah.
Did you have any kind of hospitalizations when you were a child?
No.
That's good. Okay. No surgeries or any kind of like trauma or accidents?
I broke my thumb.
Okay,
Other than that, no.
but it's healed up nicely?
Yeah.
Okay, that's good. Alright, did you have measles?
Nope.
Mumps?
Nope.
Chickenpox?
Nope.
Rheumatic fever? Scarlet fever? Polio?
Mm-mm.
Okay. And have you ever seen a doctor about your mental health?
No.
Okay. Have you we're gonna talk about some of your childhood immunizations.
Sure.
Do you know if you've had the polio vaccine?
Think so.
Okay. Measles, mumps, and rubella?
Yeah.
Okay. And Haemophilus influenza, or HIB, it's
Yeah.
sometimes called?
Yeah.
Okay. And tetanus, diphtheria, pertussis?
Yes.
Sorry, I probably should ask them one at a time. Tetanus?
Yes.
Or was that a yes to all three?
Tennis pertussis. And what was the other?
Sometimes they're grouped, that's why I asked it. There's
Yeah.
something called a Tdap, it's got all three of them.
Oh, okay.
So, so
Yeah, I
tetanus.
think I've had that one.
Okay, that's great. And rotavirus?
Not sure about that one.
Not super common anymore. Hepatitis B?
Yes.
Okay. And chickenpox?
Yes.
Okay. And pneumococcal?
Not sure.
Okay, that's fine. Okay, but generally, would you say your general health is okay?
Yeah.
Would you say it's pretty good?
Yeah.
No main complaints, nothing chronic?
No, I don't think so.
That's good, okay. So, and again, these are the
No problem.
standardized questions
Yeah.
we ask everyone. Thyroid disease?
No.
Okay. Any heart disease?
No.
Hypertension? High cholesterol?
I did have high cholesterol before,
You did have high cholesterol before?
Mhm.
Okay.
but that's improved.
That's okay. Did you take, you don't take medicines, correct?
No.
What made that better?
I'm not sure. I think I just like ate healthier that following year. Not that I
Okay.
don't know if that like really influences it that much, but
Oh, that it can.
Yeah.
Some people, that's all they need. That's all you need.
yeah,
It's highly genetic, so
yeah,
that's good. That I'm glad that
Yeah,
you were
that's
able to control
my
it.
family.
Yeah. Okay. So it runs in your family.
Yeah.
Okay. Yes, very much so. You don't have diabetes?
No.
Any breathing problems?
No.
COPD or asthma? Okay. You don't have any cancer or history of cancer as a kid? Okay. Any liver problems? Hepatitis?
No.
HIV? Okay. And kidney disease?
No.
Blood clots?
No.
Okay. And have you been depressed or anxious before? Okay. Have you had any kind of major accidents or injuries?
Just the broken thumb.
Broken thumb, that's right. You did say that. But it's all back together now.
Mhm.
And when did that happen?
This was like maybe like 2010.
Okay. 9 years ago. And when did and I'm sorry, did you say right or left?
Right. Yeah,
Okay. And are you right-handed or left-handed?
right.
Oh, isn't that a joy?
Yeah, exactly.
I'm sure you didn't realize how much you used that hand, huh? And did they put you in a cast?
Yeah, it was like not a full like hard cast, but it was like an immobilizer.
Like a sort of a
Splint.
splint? Okay. Cool. And you came out just fine.
Yeah.
Complications. That's
It
good.
is a lot.
That's very good. And you said no hospitalizations, is that correct?
Yeah, no hospitalizations.
Okay. And no surgeries, correct?
No surgeries.
Okay. Have you had your flu shot this year?
Not yet.
Okay. Do you get one regularly?
I had one last year, but I not usually.
Okay. Now's around the time where we start giving them out, so we'll be able to, if you're interested, maybe you can get one today. Already talked about those. Have you had a screening mammogram?
No.
Okay. Colonoscopy?
Nope.
How about a
recently.
Okay.
I think they just started doing them like when you turn 21.
Okay, I gotcha. And was it normal?
Yes.
Okay, that's good. And you had mentioned, you had mentioned high cholesterol. When was the last time you got your cholesterol checked?
It's been a few years, not really sure.
Okay. But you've been
But
keeping
since
up with
then.
your diet?
Yeah.
Okay, that's good. Great. Have you ever had a DEXA bone density scan?
I'm not sure. I don't
Okay.
know, I haven't.
Okay. A skin test for TB, tuberculosis?
Yeah, I've had one of those before.
Okay. Do you remember if it was positive or negative?
It was fine.
It was fine. So it was negative?
Negative.
Okay, that's good. Negative's one of those weird words. In medical field, we love negative. Have you had a lung cancer screening?
No.
Okay. Okay. You said no contact before the psychiatric services. And again, these are routine questions we ask everyone. Do you have any history of self-harm?
No.
Okay. And you've never been admitted for psychiatric reasons? Okay. Alright.
Luckily.
Yes, that is good. There's nothing wrong with that, right?
Exactly.
Alright. So I'm gonna ask some questions about your women's health. This is all routine questions.
Sure.
How old were you when you got your first period?
15.
Okay. And how often do you have your menstrual period?
Monthly.
Monthly, okay. And how long does it last?
4 days.
4 days, okay. Do you have, to describe your flow, would you say it's light, medium, heavy?
Probably like
Medium?
low
Okay.
medium.
Gotcha. When was your last period?
Don't remember. Maybe like 3 weeks ago.
Okay. Let's see. Have you ever had any extremely painful periods, or any how about any absence of period?
Yeah, when I went to travel, there was a period where I didn't get it, but.
Okay. When was that?
2 years ago.
Okay. So pap smear, last one was 6 months ago. Do you have any? Have you ever had any kind of STIs?
No.
Okay. Have you ever been pregnant before? Okay. What are your methods of contraception?
Condoms.
Okay. Let's see. I'm gonna ask some questions about your family history.
Okay.
Let's see. Do you have any conditions that run in the family? I know you mentioned high cholesterol,
Yeah.
right? Okay.
Pretty much.
And can you tell me where, is that on your mom's side, your dad's side?
My mom and dad both have it, but I'm not
Okay.
sure about anyone else.
Gotcha. Tell me about your paternal grandfather. Is he still alive?
Yes, he is.
Okay. Does he have any major health concerns or conditions?
No. He had a stroke,
Okay.
but other than that, no.
Alright, and when was that?
3 years ago?
Yeah. Is he doing okay now?
Yeah.
Okay. And how about your paternal grandmother?
She's alive. I don't really know her family history, or her history.
Okay.
I think she's pretty healthy.
Generally pretty healthy. Okay. How old is she?
She is 80.
Okay. 80. Alright. How about on your mom's side? Your grandfather on your mom's side?
He's alive.
Okay. How old is he?
He's 76.
76. Okay. Does he have any major health concerns? Or I keep saying concerns like he's the one here. So, does he have any major health problems?
No.
Okay. And how about your grandmother?
No health problems.
How old is she?
She is
Ballpark.
74.
74. Okay. And do you know how old your father is?
57.
That's not the way I should leave that question. Are your parents still living?
Yes.
Okay. And how's your father? How old is he?
57.
57, that's
Yeah.
right. Okay. Does he have any major health problems besides the high cholesterol?
No.
Okay. How about your mother? Is she doing okay?
Yep. Same thing.
Is she also 57?
She's 54.
54. Okay. High cholesterol. Do you have any brothers or sisters?
I have a brother.
One brother. Okay. Is he older or younger or twin?
He is younger.
And how old is he?
18.
18. Okay. No children or grandchildren. Okay. I kind of think that's time.
Probably.
26 minutes and 53 seconds.
Perfect.
Okay. Cool. That was actually kind of fun.
Yeah.
I'm not gonna lie.
Yeah, it was good.
Yeah.
We got to like the same area.